Administering medications is an important part of nursing practice and a skill that every nurse must learn. This program will show the different supplies used for the administration of intramuscular, subcutaneous, intradermal, and intravascular medications and demonstrate how to withdraw solutions from vials and ampules, reconstitute powdered medications, and use pre-filled syringe systems. Aseptic technique must be followed when using this equipment to withdraw medications. Some syringes are packaged with needles attached, or syringes and needles may be selected separately and assembled. The maximum capacity of the syringe is indicated on the package. Volume is measured in milliliters, which is equivalent to cubic centimeters. Some syringes measure volumes in 0.2 of a milliliter, while others measure in increments as small as 1/100th of a milliliter. Insulin syringes are calibrated to measure units. It is important to select a syringe that can accurately measure the required volume of fluid to be administered. The syringe tip, inside of the barrel, and the plunger must be kept sterile. The outside of the barrel and the end of the plunger may be handled. A luer lock syringe allows a needle to be securely screwed in place. A slip-tip syringe does not have the threads to screw a needle onto the syringe. Needle size is printed on the package. This needle is a 23 gauge by 1 inch long. The gauge defines the diameter of the needle and reflects size inversely. The greater the needle diameter, the smaller the gauge number. Therefore, a more viscous fluid requires a larger gauge. The hub connects to the syringe tip. The needle is covered with a cap. And the bevel is the cutaway angled end of the needle. The needle must be kept sterile. Safety needles or safety syringe systems are designed to protect healthcare workers from accidental needle stick injuries. No system is 100% foolproof. Providers must follow safety precautions at all times. A needle stick can have serious consequences. This style of safety needle is pushed against a firm surface to close and lock it before disposing of it in a sharps container. A similar style is pushed closed and locked with the thumb or forefinger while directed away from self and others. This safety system has a fixed needle that cannot be changed. When the injection is complete, apply additional pressure to the tip of the plunger, and the needle retracts into the syringe. This safety syringe has an outer guard that slides and locks over a fixed needle. This syringe also has a fixed needle that cannot be changed. It has an outer barrel that slides out over the used needle and locks. Blunt fill needles or vial access cannulas also may be used to withdraw fluid from a vial. An adapter can be used to allow vial access without a needle. The first step after removing a pre-assembled syringe with removable needle from the package is to tighten the needle onto the syringe. Needles can be tightened on a slip-tip syringe using the same motion as with a luer lock needle. To uncap a needle, hold the syringe in the non-dominant hand and grasp the cap with the dominant hand. Pull the cap off with a sweeping motion while keeping the non-dominant hand still. A needle may be recapped only if it has not been used on a patient. Recap a needle using the one-handed scoop technique. Once the cap has been scooped, grasp the lower end of the cap to push and lock it into place. To assemble a syringe and needle, first open the syringe package and then open the needle package. Remove the protective cover and place the needle on the hub with a twisting motion. Proceed in a similar manner if the needle needs to be changed. Hold the syringe with the attached needle in one hand and open the new needle package. Remember that the new needle hub and the syringe tip must remain sterile. Unscrew the old needle, screw on the new needle, and dispose of the old needle in the sharps container. Injectable medications come in a variety of containers. Before drawing up any medication or fluid, be sure to check the expiration date. As with all medications, those that come in a vial or ampule must be discarded by the expiration date, even if unused. A single-dose vial and all ampules must be discarded after one use, even if the entire amount was not used. A medication such as insulin comes in a multiple-dose vial. Follow agency policy regarding labeling with open date or with the appropriate discard date. Discard any undated open vial. To withdraw fluid from a vial, select a syringe that accurately measures the desired volume. For example, a volume of 0.18 milliliters can only be measured with a 1 milliliter syringe, commonly called tuberculin syringe, which is marked in increments of 1/100th. A volume of 2.7 milliliter is measured with a 3 milliliter syringe, which is marked in increments of 1/10th. A volume of 2.8 milliliters can be measured with a 3 milliliter syringe or with a 5 milliliter syringe, which measures in increments of 2/10. Note the volume is measured where the black end of the plunger touches the inside of the barrel. Select the appropriate supplies to withdraw 2 milliliters. Open the vial and rub the top with alcohol. Let the alcohol dry while preparing the syringe and needle. Open the syringe and tighten the needle onto the syringe, if using a system with a removable needle. With the cap still covering the needle, pull back on the plunger to draw air into the syringe equal to the volume of fluid to be withdrawn from the vial, in this case 2 milliliters. The air equalizes the pressure in the vial to allow easy withdrawal of the same amount of fluid. Remove the needle cap. Stabilize the vial and insert the needle through the center of the stopper. In this case, inject 2 milliliters of air into the vial. Maintain pressure against the plunger handle. Invert the vial. Make sure the needle tip is below the fluid level. Securely hold the syringe and vial straight up. Pull back on the plunger to withdraw approximately 2 milliliters of fluid from the vial. Tap the syringe until the air bubbles are collected at the top of the syringe. Push the plunger while observing the needle tip to ensure no more air bubbles are present. Now, check the volume of the fluid in the syringe. You may need to add more fluid or eject some of it back into the vial in order to obtain the exact measurement. To withdraw all of the fluid in a vial, it may be necessary to tilt it. Place the vial on the counter and withdraw the needle and syringe. Carefully recap the needle. Some vials contain a powdered medication. A diluent must be added to the vial to reconstitute it to a fluid. Follow reconstitution directions on the vial or in a drug reference to obtain the proper amount and type of diluent. Inject it into the vial. And mix according to the directions. Some vials of medication contain a powdered medication and a diluent, separated by a stopper. Pressure against the outer vial stopper forces the inner stopper through the neck of the vial, allowing the diluent to mix with the powder. To withdraw fluid from an ampule, select the appropriate syringe and filter or filter device. These are used to remove glass particles that may fall into the fluid when the ampule is broken. The filter device must be discarded after drawing up the drug. It is never used to administer the medication. Attach the filter device to the syringe. Do not add air to the syringe as there is no need to equalize pressure in the open ampule. Dislodge fluid from the upper portion of the ampule by tapping or by rotating in a small circle. Protect fingers from glass cuts with a gauze pad, an unopened alcohol swab, filter wrapper, or ampule breaker device. Hold over a sink and securely grasp the base of the ampule with one hand. Grasp above the ampule neck with the protected fingers and firmly snap neck back. Discard the upper portion of the ampule in the sharps container with the protective gauze, which may contain glass particles. Insert the tip of the filtered device into the fluid and draw or aspirate fluid into the syringe. It may be necessary to tilt the ampule to obtain all the fluid. Keep the tip of the filter device in the fluid. Fluid may also be withdrawn from the ampule with it held upside down. Keep the tip of the filter device in the fluid and aspirate the contents. Do not eject air back into the ampule or fluid will leak out of the ampule. Dispose of the ampule in the sharps container and recap the filter device. Hold the syringe upright and tap the air bubbles to the top of the syringe. Aspirate air into the syringe to clear fluid from the syringe tip. Remove the filter device. Eject air from the syringe so that fluid is just at the syringe tip. Add the appropriate needle or adapter to administer the medications. To eject excess fluid, remove the needle cap. Point the syringe down towards the sink and eject the excess amount. Injecting fluid into the air could contaminate the sterile tip of the syringe. Recap the needle. Some medications are supplied in pre-filled syringe systems. Carpuject cartridges have an attached needle, a luer lock tip, or a needleless tip system. A small needle inside the assembly pierces the cartridge when loaded into the reusable holder. To load a Carpuject cartridge into its holder, twist the blue mechanism to the open position, pull back the plunger, and slide the cartridge into the holder. Twist the blue mechanism closed and watch the needle assembly seat itself into the cartridge. Hold the cartridge while twisting the plunger clockwise. To remove air from the cartridge, hold the unit straight up. Aspirate air to clear the fluid from the assembly, and then eject the air. To eject excess fluid, point the needle end down and depress the plunger. The Carpuject system is now ready to use. Empty the cartridge from the holder by reversing the assembly process. Secure the cartridge while unscrewing the plunger. Twist open the blue mechanism. Slide the cartridge out and deposit it into a sharps container. Fluid can also be transferred from a Carpuject cartridge to a syringe. This may be necessary if the attached needle is not the correct size or if the medication is to be mixed with another medication. simply pull the syringe plunger back. Insert the Carpuject needle through the syringe tip and inject the fluid. Add a needle to the syringe. The cartridge also can be used as a vial. First, remove the tip assembly and discard it in a sharps container. Insert the needle into the cartridge and aspirate the desired amount of fluid. The stopper moves down, so adjust the needle tip as needed while withdrawing the fluid. Another type of pre-filled syringe system requires the protective caps to be popped off and the two parts screwed together. Some pre-filled syringes are ready to use when removed from the package. It is important for nurses to be familiar with the variety of syringes and needles available in order to competently use the appropriate supplies.